If you're a frontline medical professional here in Merced County, this explainer is for you. We're about to break down Senate Bill 43, a law that's giving you a really important new tool to help some of our most vulnerable patients. So let's dive into what's changing and how it's going to affect your daily practice. You know this scenario. We've all been there. You're standing with a patient who is just clearly a danger to themselves, but they don't quite fit into that super narrow box for a psychiatric hold. And it is so frustrating. It's this dangerous gap in our system of care, right? They aren't saying they're suicidal, they're not a direct threat to someone else, but you know in your gut that discharging them is a huge risk.
Well, that's exactly where Senate Bill 43 comes into play. The best way to think about it is as a brand new tool in your clinical toolkit. It's designed to close that exact gap we were just talking about, so you can intervene earlier and hopefully prevent a tragedy.
Now, to really get why this new tool is so important, we have to look at the old framework it's updated. That's the Lanterman-Petra-Short Act, or LPS. Since the 60s, it's had this super specific, really narrow definition of gravely disabled. Basically, can they get food, clothing, or shelter? And clinicians have been saying for years that this just doesn't cover the complex realities we see every single day. And this slide right here, this is the game changer. On the left, you've got the old LPS definition, laser-focused on just food, clothing, and shelter. But look at the right side. SB 43 expands that definition to include personal safety and necessary medical care. And believe me, this is not a small tweak. This is a fundamental shift in how we can approach these cases.
So let's get specific. What does SB 43 add? Well, now the term gravely disabled can include a person's inability to provide for their own personal safety or get necessary medical care. And this next part is huge. The law now explicitly includes severe substance use disorders as a primary cause. That is a major change.
So why was this change so urgent? It really all comes down to helping patients who lack insight into their own illness. Anosognosia. These are the people who aren't trying to harm themselves or others, but their inability to recognize they're sick puts them in grave danger. This law is about stepping in before things spiral. All right, so theory is great, but let's get practical. This is probably the most important part for you. What does this actually look like when you're at the bedside trying to figure out what to do with a patient? Let's walk through a couple of real-world examples. First up, picture this: a 60-year-old man with schizophrenia. He's refusing to take insulin for his diabetes, and he's just been found wandering into traffic. Under the old rules, because he isn't actively suicidal, he might have been discharged. But now, with SB 43, it's a completely different ballgame. His refusal to take insulin, that's an inability to manage necessary medical care. Wandering into traffic, that's a clear inability to provide for his personal safety. You put those two together, and suddenly you have very strong grounds for a hold under this new expanded definition.
Or how about this one? A 35-year-old with schizoaffective disorder who keeps showing up in the ER with infected wounds. He's in a state of psychotic denial and just doesn't see the danger he's in.
You see that pattern of repeated ER visits? That shows he's just unable to care for his own medical needs. You combine that with his lack of insight and this whole high-risk situation of medical self-neglect, it falls squarely within the expanded SB 43 definition. So, what does this mean for us day to day? Okay, this is really important. Our documentation has to change. It's got to evolve, big time. We can't just write appears unsafe in the chart anymore. That's not going to cut it. You have to paint a really clear, specific picture in your notes. Describe the exact unsafe behaviors you observed, like patient observed walking into active traffic. Note the evidence of medical neglect, like multiple untreated infected wounds on lower extremities. And documenting the patient's lack of insight or poor judgment. That is absolutely crucial to making the case.
Okay, so you get the law, you see how it works with patients. Now for the really time-sensitive part. Let's talk about what you need to do to get ready right here in Merced County.
All right, pull out your calendar, because this date is key. While the law went into effect statewide in 2024, each county has to actually opt in. For us here in Merced County, the go-live date you need to remember is January 1st, 2026. That is when we will officially start using these expanded SB 43 criteria.
So the big takeaway here is you need to start getting ready now. Don't wait. Here's your action plan. First, obviously, know the date. Second, start practicing now. Consciously integrate these new criteria into your patient assessments. Third, remember you're not alone in this. Collaborate with your colleagues in psychiatry, social work, and legal. And finally, keep your eyes peeled for trainings.
And hey, speaking of trainings, since severe substance use disorder is now such a key part of this law, for any nurses looking to brush up their skills, you might want to check out the CA Bridge Academy's course on nursing management of substance use disorders. It's a great resource. You know, as we wrap up, it's important to remember that this is a powerful new tool, but it also puts a pretty profound ethical question in front of us. This law doesn't just erase patient autonomy. It challenges us as clinicians to very thoughtfully and carefully balance that autonomy with our fundamental duty to protect people from harm. And to help you navigate all this, we want to make sure you have the key local resources right at your fingertips. Think of these folks as your support network as you start to use SB 43 in your practice.
Okay, maybe get your phone ready, because you'll want to save these numbers. First, bookmark the Behavioral Health and Recovery Services webpage for SB 43. For immediate help, the 24/7 crisis line is 209-381-6819. The Care Court team can be reached at 209-381-6820. And the Public Guardian's Office is at 209-381-6840.
So, we'll leave you with this question to think about. You now have a new tool in your toolkit, one that's designed to help you step in earlier and more effectively. The question for all of us is, how will we change our practice to use this tool and intervene before a crisis becomes a tragedy? Thank you for your time, and seriously, thank you for the life-saving work you do every single day.